Imagine you are on the rounds and the patient collapses in front of you. What you will do first? Before the panic sets in, let's see the 5 most common causes of unconsciousness, knowing which can help to save the life of your patient. So let's get started. So the first cause and the one that is very easy to treat is hypoglycemia. So whenever a patient of unconsciousness comes to you, first see the RBS of the patient. So this hypoglycemia is more common in patients of diabetes, alcoholic patients and the one who are on fasting. What can be the symptoms? There can be sweating, there can be palpitations, or there can also be seizures. And as I have already said, this condition is very easy to manage. You can give IV dextrose to the patient and treat patient's hypoglycemia. So this is the first cause. Then the second cause is seizures. This is also easy to manage. Seizure is because of the abnormal electrical activity in the brain. Here you can get an important clue of patient having a history of epilepsy. And in which type of seizures unconsciousness is common? It is more common in seizures like generalized tonic-clonic seizures. And in this case, the postictal infusion or postictal confusion or drowsiness is also very common. So this is the second cause, that is seizures. Then the third cause is syncope. What is syncope? Syncope is a loss of consciousness due to low brain perfusion. When the blood supply to the brain is decreased for some reason, then what we get is syncope. Here the loss of consciousness is very brief and the recovery is also very quick. The syncope is of 3 types. It can be a vasovagal syncope, cardiac syncope or orthostatic syncope, of which cardiac syncope is very important and it needs to be evaluated further. Here 2 investigations can help you out. First is the ECG, where you can get something called as arrhythmia, or you can also do 2D echo, where you can get some conditions like aortic stenosis. So this is an important third cause of unconsciousness, that is syncope. Then the fourth cause can be stroke. Generally in stroke we get focal neurological signs, but in certain strokes like brain stroke or when there is a massive hemorrhage, as you can see here, when there is a massive hemorrhage, there can be a loss of consciousness. And the important sign here is asymmetric pupil. And the investigation that we have to do here is CT brain, because this can distinguish whether the stroke is hemorrhagic stroke or it is a non-hemorrhagic stroke. Now the fifth and the last cause of unconsciousness is traumatic brain injury. Here you can get the history of either road traffic accident, fall from height, or there can also be an assault. Generally these types of patients are having a Glasgow Coma score of less than 8. There can be something called as lucid interval. What is lucid interval? Here initially the patient is unconscious, then regains consciousness for some time, and then after some hours again become unconscious. This is lucid interval, and it is common in this type of hemorrhage, that is epidural hematoma. So this is lucid interval. What are the causes of unconsciousness in traumatic brain injury? There can either be increased intracranial pressure or diffuse axonal injury. And here a drug called mannitol can help the patient by decreasing the intracranial pressure, or there can be a surgery called as decompressive craniotomy that can also help the patient in this condition. So friends, these are the 5 important and the most common cause of unconsciousness. And in summary, in case of hypoglycemia, the important point to remember is it is more common in diabetic patients, especially who are on the anti-diabetic treatment. Second, in case of seizure, the important point to remember is that there can be an important clue of history of epilepsy. In case of syncope, important thing is that you have to rule out the cardiac cause of syncope, and if there is a cause of if there is a cardiac cause for syncope, then patient needs to be evaluated further. In case of stroke, you have to do an important investigation of CT brain to distinguish whether the stroke is hemorrhagic stroke or non-hemorrhagic stroke. And in case of traumatic brain injury, early mannitol can help the patient. So friends, remember, unconsciousness is a symptom and it is not a diagnosis. So always think broadly and act fast. If you find today's video helpful, give it a like, share with your friends and subscribe this channel for more clinical insights. Stay sharp, stay prepared. Thank you.